1 in every 20 Americans over the age of 50 has peripheral arterial disease, also known as PAD. It's a condition that raises the risk of foot wounds, heart attacks, and strokes. Vascular surgeon Dr. Chris Marrocco at Pomona Valley Hospital Medical Center examines how PAD is monitored and treated.
Peripheral arterial disease is vascular disease of the lower extremities. It's a systemic disease of the whole body, but what we're looking at is when it affects the legs, you have problems with walking. Usually you can't go as far or walk as far as you were able to in the past, and your distance is getting shorter and shorter. We tend to treat that conservatively at first, having people do a walking exercise program to get them to walk further and walk through it, because you can have an angiogram that looks horrible with lots of blockages everywhere, and the guy's a postman and can walk all day without a problem. So we tend to treat people that have problems with their lower extremities, what we call lifestyle claudication. Claudication is pain with walking, literally. And when I have somebody come in the office, they say, "Hey doc, I can walk 2 blocks. And then I have to stop, my leg hurts really, really bad. I wait 3 minutes, I can walk 2 blocks again." That same distance with the similar rest period is sort of what we call pathognomonic, or defines the disease for us. From that point, again, we would start conservatively, exercise programs and that kind of thing, and then move on to an angiogram. I tend to treat almost all of these patients endovascularly. If there are long occlusions or blockages, we do bypasses around those. We can also take the plaque out from the inside with a remote endarterectomy, which is a ring that goes in and pulls out the whole plaque. We tend to treat these minimally invasively, once, twice, 3 times before ever going to an open procedure. Patients leave the same day or the next day. That's one end of the spectrum. The other end of the spectrum is the person that comes in and has a rotten toe, a black toe, or an ulcer on their foot that's not healing, something like that. They tend to have the other end of the spectrum, or really progressive bad vascular disease. Again, we treat them very similarly, but there's no walking program or anything. This is what we call critical limb ischemia, meaning there is tissue loss. There's an ulcer, there's a sore, there's something like that, and we treat that more sort of urgently. Like, they'll come in the office, we'll look at them, we'll get the studies, and we'll do the operation sort of within a week or 2 weeks sort of time period. And the whole idea there is to work as a team with the podiatrists, orthopedic surgeons, wound care, to get them the blood flow that then, you know, the wound care people and everybody else can then heal the wounds now that they have the blood flow, antibiotics can work, and everything else.